धर्म ओपन कर रहे हो पीपीटी?
Yes, sir.
यस प्लीज
जी
ओपन.
sir. So, are you able to see the PPT? Hello.
Yes, yes, yes.
Okay. Okay.
नाउ वी आर एबल टू सी. जब तुम बोलते हो उसके 2 मिनट बाद आता है, 1 मिनट बाद, सो अकॉर्डिंगली करना.
Okay, sir. Okay. Hello. May I start, sir?
यस यस प्लीज स्टार्ट. कुछ बैकग्राउंड में कुछ नॉइज आ रहा है ना, घड़ी चलने का कुछ आवाज है, कुछ लग रहा है जैसे.
हाँ सर, घड़ी चलने की आवाज आ रही है.
ठीक है चलो.
Okay, so guys, Adar, Adab, Abhinandan, Sat Sri Akal. This is not Amitabh Bachchan, this is Dharm Desai. And today we are going to discuss about the following topics that are presented on the screen. Are immunology, AIDS, cancer, and the very favorite topic of Johnny Walker as well as Kabir Singh, which is drug alcohol abuse. So immunity is a very funny thing. It is just like movie known as Border. So have you seen the
So
movie?
this is part remaining part of your chapter ना? कौन सा चैप्टर था
Yes, sir.
उसको
Yes, sir.
मेंशन?
Human and diseases, human health and diseases.
Yes.
So may I continue, sir?
Yes करो.
Okay. So immunity is a very funny thing. It's just like the movie that is known as Border. There are several soldiers who are protecting from the outside, and there are several ministers or politicians who are protecting the country from the inside. So basically, what is immunity? So immunity is the balanced state of the multicellular organisms which is having adequate biological defense to fight infectious disease and other unwanted biological invasion, and also having adequate tolerance to avoid allergy as well as the autoimmune diseases. So immunity is also called as a disease resistance. Okay, so the lack of immunity is known as susceptibility. So that person would be susceptible to several diseases. Either those diseases are infectious or non-infectious. So the overall ability of the body to fight against the disease, the disease causing microorganisms or the pathogens with the help of immune system is called as immunity. This is the basic definition of immunity that I have included after the complex mechanism. So you can write it in exams also. So there are basically two types of immunity: innate and acquired immunity. So there is a saying that you make your legend or you born with it, or I could say that you born with your legacy or you create your own legacy. So if you are born with your legacy, if you are born with your immunity, then that particular immunity is known as innate immunity. And when you develop that particular immunity, when you are getting old, that particular immunity is known as acquired immunity. Okay, so innate immunity, or you can say inborn immunity. So innate immunity is inherited by an organism from the parents, which will protect the fetus from birth throughout the life. So innate or non-specific immunity lacks specific response to specific invaders. So this particular type of immunity will be provided by various barriers present in our body. So innate immunity consists of these following types of barriers. So the barriers are physical, physiological, cellular, and cytokine barriers. I must appreciate the woman who have euthanized her body in order to give us this particular diagram. So three cheers for this particular woman. Let us go to the physical barrier. So physical barrier consists of skin, which is you can say the largest or the biggest defense mechanism exists on our body. So skin on our body is the main barrier which will prevent the entry of microbes and mucus coating of the epithelium lining, uh, which will be present in the respiratory as well as GI tract as well as uh, urogenital tracts, which will help in the trapping of microbes and that particular entrapping of that microbes, which will cause the disease. That barriers will protect us from that particular microbes via trapping them. Okay. So the second one is physiological barriers. So physiological barrier consists of the stomach acid, which is present in our stomach, HCl, hydrochloric acid, saliva in our mouth. As in the previous lecture, someone has mentioned lysozyme, which is present in our saliva. It also works as a physiological barrier. Okay, tears from our eyes. It also contains lysozyme and several lysis enzymes, which will these all enzymes will prevent microbial growth. The third one is cellular barriers. So there are certain types of leukocytes, or you can say white blood cells of our body, like polymorphonuclear leukocyte, or you can say simply leukocytes, neutrophils, monocytes, and natural killer cells in the blood, as well as the macrophages in the tissues, which will phagocytosize and destroy the microbes. What they will do particularly, they will just go and they will eat the microbe that is causing the infection. Have you seen the movie Ghazni? So when that particular natural killer cell uh, would see someone foreign, they will just go berserk on that particular pathogen and they will just kill them. Okay, they will not think that this particular pathogen is big or bigger than me, or it is having higher intensified strength than me. They will just go and try to kill it, just like Ghazni, just like Amir Khan. Or the very famous example is Hulk. Hulk will smash. He just don't think. He just think like, hey, you are my competitor. No, I will just destroy you, just like that. So the fourth barrier is cytokine barriers. So cytokine barriers includes the virus infected cells, which will secrete protein called as interferons, which will protect non-infected cells from further viral infection. So the name interferon suggests that that will interfere in the viral replication cycle, or they will interfere in the infection which is being caused by virus, and they will tell the other cells that, hey, uh, this virus has been causing this kind of thing, and I am just very furious and I'm dying. You just have to need to be aware of me and just take yourself away from me. Okay, so that particular cells will do this, the thing that has been directed by the viral infected cells, uh, just because of the interference. So thanks interference. These are particular schematic diagram which presents the various barriers present in our immune system or innate immune system. So again, 3 cheers for this particular woman who have euthanized her body for the sake of this particular diagram. And this diagram also shows the cellular and cytokine barriers or the second guard post. So when a particular pathogen will invade the skin and the skin would not be able to compete with that pathogen, the cellular and cytokine barriers will take the stand and they will compete with that pathogen. So how they will compete? They will go to that pathogen and they will try to kill it. Okay, let me just. So this is the natural killer cell trying to engulf that particular pathogen. He is just going in berserk mode and he will eat that particular pathogen. And this is the macrophage and dendritic cells, which are uh, which are trying to engulf a small part of pathogen in the sense of presenting that particular antigen to the MHC or major histocompatibility complex of B and T cells, which we are going to study in the further slides. So this is how the activation of adaptive immune responses occurs. So what will happen if the immune or adaptive immune response will activate it? So the antibodies will be formed for this particular pathogen. This particular pathogen, anti-pathogenic antibodies would be formed, and T cells would be stimulated. So that will go and will kill the that particular pathogen. So the next topic is acquired immunity. So this the acquired immunity that an individual acquires, as the name suggests, the individual acquires that particular immunity after the birth, which is known as acquired or adaptive immunity or specific immunity. Because uh, in this kind of immunity, cells will think first, then kill. In innate immunity, they will just go berserk, man. They will just go and kill any of cells uh, which will be uh, shown as the foreign. So the acquired immunity is specific and mediated by antibodies or lymphocytes or both, which can make the antigen harmless. So it just not only relieves the victim of the infectious disease, but also it will prevent it and further attack in the future. How it will going to further attack that particular pathogen in future? Simple. When that particular pathogen will come again with several brothers of him or her, then this particular acquired immunity has specific memory for this kind of pathogens, which we are going to discuss in the further slides. So, moving to the next point, the memory cells formed by B and T cells. Yes, we are talking about memory. The memory cells formed by B and T cells are the basis of the acquired immunity, because it will know that this pathogen has invaded us before. So what kind of defense we have to develop against this pathogens after the attack happens twice? Okay, so thus acquired immunity consists of specialized B and T lymphocytes and antibodies. So this is the characteristics of acquired immunity: specificity. So it will be able to differentiate between self and non-self. Diversity. So it will recognize vast variety of foreign molecules. So it will discriminate between self and non-self, same as the specificity. So it can recognize and respond to the foreign molecules and can avoid responding to those molecules that are present in the body. So it will also develop the memory. How it is going to develop the memory? When the immune system encounter a specific antigen or a specific foreign agent, which is known as antigen, or you can say pathogen, for the very first time, it will generate an immune response and will eliminate that particular invader. This is known as, or this is called as very first encounter or first encounter. After that, the immune system retain the memory of the very first encounter, and as the result, it will conclude when the second encounter happens. We know that the immune system knows about that particular pathogen which have already invaded the immune system from the very first at very first time. It will contain the memory. So now, what will the immune system do? Yes, I know that you have already invaded us, and you have caused so many troubles. So I am just gonna kill you, my friend. And they will go berserk. The primary and secondary immune responses are carried out with the help of two specific or two special type of lymphocytes known as B and T lymphocytes. The B lymphocytes produce an army of protein known as antibodies, which will directly neutralize that particular uh, pathogen or antigen, and further that neutralized antigen antibody complex would be engulfed by the phagocytosomes or phagosomes. The T lymphocytes, the T cells themselves do not produce the antibodies, but with the help of B cell, they will produce them. So T cells have so many cousins. So T helper cells, T cytotoxic cells, T memory cells, T effector cells, and then tissue resident memory cell, tissue central memory cells. There are so many cousins of T cells, and which is going to help in generate memory of this particular disease or about this specific antigen. So what they will do, T helper cells will stimulate the B cells to produce antibody. On the other hand, they will also stimulate this TC cell or cytotoxic T cell that uh, the B cells are going. So you should go to, my friend. You should go to kill that particular pathogen that have already invaded us. So what you have to do now? You just have to go with the antibody, and with the help of antibody you are going to kill that particular pathogen if that particular pathogen is bigger than what we have thought. So that antibody mediated killing would be known as antibody dependent cytotoxicity or antibody dependent cell mediated cytotoxicity. So what is the basic difference between the innate and acquired immunity? That innate immunity presents from the birth, acquired immunity develops after birth. Innate immunity which will remain throughout the life, and acquired immunity which will be short-lived or lifelong. So innate immunity uh, uh, would be provided if the contact or the exposure with the pathogen or its antigen, which is not essential. So this particular immunity is non-specific, so we do not require the contact of that particular pathogen with our cells. And in acquired immunity, the contact is essential to ensure the memory of that particular pathogen. So innate immunity is inheritable, whereas the acquired immunity is not inheritable, or it cannot be passed to the next generation except for a brief period of neonates. So, innate immunity will provide and protect the individuals from the contraction of the disease of the other organism, whereas the acquired immunity will protect the individual from the pathogen presence on other members of the same species. So now we'll be discussing B and T cells in brief. So the primary and secondary immune responses are carried out with the help of two specific type of blood cells known as B and T cells. So what will the B cells do? B cell would be stimulated with the help of T helper cells, and by the stimulation that will uh, that particular B cell will generate two type of cell. One is effector cells or plasma cell, and the other is memory cells. So memory B cell will remember the type of antigen and the structure of antigen, and the plasma cell will produce antibody against that antigen. What will T cell do? So after that particular Gossamer cells, or you could say that the antigen presenting cells, Gossamer cells are a very fancy term and which would be remembered the if I guess you are in the 11 or 12 standard. Gossamer cells are known as antigen presenting cells. So basically, we would prefer macrophage as well as interstitial dendritic cells as Gossamer cells or antigen presenting cells. What will they do? They will just take the antigen and they will present that particular antigen to the helper T cells. So what will helper T cell do? It will provide the information to B cells. B cell will make memory cells as well as the effector cells in order to produce the antibody as well as to generate a memory. And on the other hand, it will also provide the information to the TC cells or cytotoxic T cells, which will directly going to kill that particular pathogen. So lymphoid organs from which the B cells and T cells will be originated. There are organs in which origin, maturation, and proliferation of lymphocytes occur. So these are the primary and secondary organ. So the primary lymphoid organs are bone marrow and spleen. So bone marrow, which is a site of hematopoiesis, or the you can say that it is a fancy word of hematopoiesis is big bang of the lymphocytes or big bang of the cells, that it will generate lymphoid and myeloid cells, or it from normal hematopoietic stem cells, lymphoid and myeloid progenitor would be generated or would be born. And from the lymphoid and myeloid progenitor cells, certain specific cells would be born. So moving over to the thymus. Thymus is a bilobed organ located near the heart and beneath the breastbone. As you can see, it is a bilobed organ and located near the heart. This might be the heart, yes. And it is near to the beneath to the breastbone. So thymus would be very large during the birth. Gradually, it will reduce in size and it will become tiny during puberty. So thymus immatures. So in thymus, mature thymocytes from bone marrow migrate to the thymus. Let me say it correctly, that from bone marrow, the immature thymocytes or the immature T cells, or you could say that the naive T cells would transfer from bone marrow to the thymus. So what will happen? The naive T cells will travel from bone marrow to the thymus. So what particular variable is causing that particular traveling, uh, which is still unknown. This is the schematic diagram of hematopoiesis, when you can see that a multiple potent stem cell or a hematopoietic stem cell dividing in myeloid and lymphoid progenitor. After the dividing of the myeloid and lymphoid progenitor, would rise to respected cells like thrombocytes, basophil, neutrophil, eosinophil, and monocytes. On the other hand, the lymphoid progenitor would generate B and T lymphocyte. So as we have discussed already, that hematopoiesis happens in bone marrow. So the T lymphocytes or naive T cells would travel from bone marrow to thymus. So these are the secondary lymphoid organ. Basically, what secondary lymphoid organs do, that once the T cells or from primary lymphoid organ, the premature lymphocytes, as I have already told, that the bone marrow cells from the bone marrow, naive T cell would travel to the thymus. Why? Because to get matured and to get a specific function. So from primary lymphoid organ, premature lymphocytes will migrate themselves to secondary lymphoid organ, where they will get matured and proliferated to become a effector cell and memory cell. Okay. So these are the secondary organs that we are going to discuss. So the very first is spleen, and the second one is lymph nodes. So the spleen is a bean-shaped organ which contains lymphocytes and phagocytes. So what it will do? It will remove worn out red blood cells from the blood, and it will function as reservoir of the erythrocytes in fetus. So what will lymph nodes do? Lymph nodes are found in the lymphatic system, and it will function as immune activator uh, by trapping the antigens and proliferating the lymphocytes against the pathogen. So, if someone remember that in previous lecture, I have discussed that in the elephantitis, the lymph nodes would be swollen and they would be blocked. So, no waste material would go out from the lymph node. So, that particular region would become abnormally swollen, and it will look like an elephant limb. Especially this particular disease occurs in the limb part or leg part. So that particular disease has been told as elephantitis. So this was the FYI for the previous lecture. So the second uh, topic, or the yes, the second is tonsils and Peyer's pets. So the Peyer's pets play an important role in immune surveillance of the materials within your digestive system. So yes, we have already discussed about the role of Peyer's pets in the previous lectures, that what will Peyer's pitch will do. These are the defense barrier in the digestive system. So there are several diseases borne by the specific pathogens. Let me just go to the malarial slide. In the case of malaria, as well as in the case of amoebiasis, as well as yes, in the as well as in the case of typhoid, the role of Pierce patch is quite known. That is why I was telling that before starting the diseases, NCRT should have included the immune system first. So basically, what will lymph nodes do? Lymph node would be oozing out the waste material, okay, or the worn out RBCs. Or yes, we were at the Peyer's patch. So Peyer's patch is play an important role in immune surveillance of the materials within your digestive system. And tonsils are located at the throat and the palate. So what will they do? They can stop germs from entering to our body, mouth, via mouth and nose. So other secondary lymphoid organ is malt, or the mucosa associated lymphoid tissue, which will initiate immune response to specific antigen encountered along the mucosal surface. So malt including sites are secondary immune tissues where the antigen sampling occurs and the immune responses are initiated, which will be found in urogenital tract, respiratory tract, as well as digestive tract. So moving towards the next topic is antibody. So as you can see, antibody is of a Y shape. What I have observed that the variable regions. This is just for the 12 science students. That why these fab fragments contain the variable region, because that particular antigen would be bound to that variable heavy and variable light chain. That is why antibody or the fab fragment contains the variable sites. So each antibody molecule has four peptide chains, two long chains and two short chains arranged in a Y shape. Two long chains are called as heavy chain and two short chain are known as or called as light chain. Okay, so antibodies are also called as immunoglobulins, and there are specific types of the immunoglobulin. So just remember the game D, G, A, M for the types of antibody. Okay, so the IgM is pentameric antibody, IgA is a secretory antibody, and found in a monodiene trimeric shape. IgG is a very profound antibody. IgE has a very famous role in an allergic reaction, and the role of IgD is still unknown. So this is the types of acquired immunity on the basis of the immune cell acting against the antigen and on the basis of the nature of antibodies. So on the basis of immune cell acting against antigen includes the humoral as well as cell mediated immunity, which I already have described as the B cell mediated immunity and T cell mediated immunity. And on the basis of the nature of antibody, active immunity as well as passive immunity. So, do anyone has any idea about what is another name for the passive immunity? Hello, 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 hello.
Yes, we can hear you, Dharam.
Yes. So, what is another name for passive immunity?
No idea.
Passive immunity is simple. It is vaccination. So,
No. Vaccination is not passive immunity.
Vaccination is a part of passive immunity.
yes, this is
No,
just
no, no,
for
no, no.
the
Vaccination is active
No,
immunity.
active. Yeah, it's an active immunity. Yes,
Therapy, see. Therapy by antibody is passive immunity.
yes.
okay,
Using of
Therapy is a part
amphetamine.
of
okay.
passive immunity.
Okay, sir.
Yes, when we administer antibody, already prepared antibody outside the
Oh,
body,
oh, 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 oh.
that is
I'm
passive.
sorry. I'm sorry. I just I was I was in dilemma, and I
जैसे
spoke
प्लाज्मा थेरापी होता
certain
है ना,
wrong things.
मतलब दूसरे
Yes, sir. Yes, sir.
दूसरे जगह से बना हुआ एंटीबॉडी जब हम एडमिनिस्टर
Sir,
करते हैं, दैट इज पैसिव इम्यूनिटी.
एक्टिव इम्यूनिटी एक्टिव इम्यूनिटी बोलना था, भूल से पैसिव
यस
इम्यूनिटी
यस
बोल दिया
यस
मैंने.
एक्टिव
Yes, sir.
इम्यूनिटी
Yes, sir.
दिस इज वैक्सीनेशन इम्यूनाइजेशन है ना.
Okay, sorry, Mohit.
कंटिन्यू
uh,
कंटिन्यू.
So we were discussing that the two types of immunity, according the one is according to the cell acting against the antigen, and the second one is the based on the nature of antibodies. So there are humoral immunity and cell mediated immunity, which I have already described it as B cell immunity as and T cell immunity. So, on the other hand, based on the nature of antibodies, there are two types: active and passive immunity. So we are just going in brief of humoral and cell-mediated immunity. That what will happen in humoral and cell-mediated immunity. As I have already discussed, that the B cell would secrete certain amount of antibody when they would get stimulated from the T helper cells, and antibodies will neutralize that particular antigen, and further that particular antibody antigen complex would be phagocytosized by the phagocytic cell. On the other hand, uh, when we are dealing with the cell mediated immunity is aggressive yet smart. So what will it do? First, the gossiper cells will come. The gossiper cells will take a small part of that virus or that particular microbe, and they will present it on the T helper cells. So what will T helper cell will do? T helper cell will motivate B cells to produce antibody against that particular antigen in order to kill that particular antigen with the help of neutralization and further phagocytosis. And a T helper cell would stimulate cytotoxic T cells, and there are certain cytokines as well as interferon which would be stimulated by T helper cells in order to activate the natural killer cells also. So what the TC cells and natural killer cells would do, they will just go and they will kill that particular cell who has been damaging our body, damaging the cells of our body. So this is the interplay of immunity, as I have mentioned before, as the primary or the first exposure and the second exposure. So in the first exposure, an antigen presenting cell or a gossiper cells would take a small part of that particular antigen, and it will present that part to a helper T cell, and helper T cell would stimulate B cell as well as T3 cells. So what will B cell do? B cell would produce antibody against that particular antigen, as well as TC cell or cytotoxic T cell would directly go to kill that cell as well. uh, T helper cell would generate certain memory cells in both lineage, B cell as well as T cell lineage. What will the memory cell uh, would function? That they will remember that particular thing, that particular pathogenic characteristic of that particular antigen or that particular microorganism. So when the second exposure happens, they will just directly order the cytotoxic T cells and B cells, cytotoxic T cells to go and kill that antibody, and B cell to produce, cytotoxic T cells to go and kill that particular antigen or the pathogen, and B cells to produce antibody against that particular antigen and go neutralize that antigen. So, based on the nature of antibodies, as the figures are suggesting, that there are two types of active immunity, natural and artificial. When we get a certain exposure of infectious pathogen, uh, from which we will develop the immunity, which is known as natural immunity. Uh, so when a host is exposed to the antigens, which may be in the form of living or the dead microbes, or rather then other proteins, antibodies are produced in the host body. So this type of immunity would be called as active immunity. The example of active immunity is antibody produced against the microorganism. So that is a very classic example. If sir would say something to any of girl or Ria or Kashaf or uh, any of girl whose name is Dikshita. Okay, if sir would say something to Karuna or Ria, so Ria and Karuna will listen quietly. Okay, and the same thing I would do. What will they do? They will just kick me to my death. they will just beat me. So the basic concept of artificial active immunity, that if the pathogen is strong, that particular immunity is known as active or natural immunity, and the infection would be random. Okay, and in the artificial active immunity, we would provide our body knowingly that pathogen which would have a low strength, or the low intensive strength, or that particular pathogen would be inactivated. So what our immune system would do? Mm, the pathogen's immunogenicity is low, so we will just going to kill it, and we will remember that particular pathogen. The classic example of sir and me, that sir is a natural pathogen, and what will Ria and Dikshita would do? That they will just simply listen to sir. The same time, someone knowingly send me to Ria and Dikshita. That just scold them. मजा आएगा चलो ना करते हैं. So what they will do? They will just kick me. They will beat me to the death, man. So that is not going to happen. Okay. This was just an example, by the way. I'm not going to do the same. So let's move towards the passive immunity, or the passive immunization. So when ready-made antibodies are directly given to protect the body against the foreign antigen, this type of immunity is called as passive immunity. So the example is yellowish fluid colostrum secreted by mother during the initial days of the lactation. And it has the abundant amount of IgA antibody to protect infant. And the artificial passive immunity, the very famous example is serum treatment in the COVID. Okay, so uh, the already manufactured antibodies in the patient who has been recovered from the COVID, we would uh, collect those patient's serum, and we would transfer the serum to infected individual, so that particular individual would have power to defeat that particular antigen or pathogen. So, what is immunization and vaccination? Immunization is the process by which an individual's immune system becomes fortified against the immunogen. When the system is exposed to molecules that are foreign to the body, called as non-self or foreign, it will orchestrate an immune response and will also develop the ability to quickly respond to a subsequent encounter because of the immunological memory. Yes, because that particular antigen is inactivated, so immune system will develop the memory, and it will uh, do the same when the second exposure happens. So active immunization or vaccination is attenuated or killed or inactivated immunogen introduced to our body, which would lead to the development of the immunological memory. uh, and the passive immunization, the direct inoculation or injection of the antibodies against the toxin present in the body, and what it will conclude in, so there will be no immunological memory developed by the body. Yes, this is the schematic diagram which would tell that whether the memory in active and passive immunity will be there or not. So what we do in the active immunity, we will provide the inactivated or attenuated antigen or pathogen to our body. So our immunity would have the memory of that cells, and we would develop certain amount of cells to kill that a particular antigen. And in passive immunity, we would directly give antibodies to our body, which would be produced from another host. So it will help in recovery and has no memory. So, what is allergy? The exaggerated response of the immune system to certain antigen present in the environment is called as allergy. So the substance to which the immune response is produced are known as or as called as allergens. Common example of the allergens are mite in dust, pollens, animal, dander, etc. Allergy is due to the release of the chemicals like histamine and serotonin from the mast cells. So what will histamine and serotonin do? They will induce our immune cells so that there are certain amount of pathogen and you have to develop extreme amount of immunity against that particular pathogens, which would result not only in the killing of pathogen but also killing of the self cells or our body cells are basically known as self tolerance. Okay, so the antibody which would be produced to these are of IgE type of antibody. The symptoms of the allergy reaction include sneezing, watery eyes, runny nose, difficulty in breathing. The patient is diagnosed by the injecting or exposing the patient to very small doses of allergens. So drugs like antihistamine, adrenaline, steroids quickly reduce the symptoms of the allergy. So the next thing is autoimmunity. Uh, the same thing I have explained in the allergy, and that when a body attacks to cells, it will result in autoimmune disorder. The examples are vitiligo, rheumatoid arthritis. So the example is given of rheumatoid arthritis is that RA is a long-term autoimmune disorder which would primarily affect the joint, and it typically results in warm, swollen, painful joint. Uh, the pain and stiffness often worse the following rest. Mostly commonly, the wrist and hands are involved with the same joints, typically involved in the both sides of the body. The disease may also affect the certain parts of the body, and results in low RBC count, inflammation around the lungs, inflammation around the heart. So, in these autoimmune diseases, immunosuppressants are must to reduce pain and will regulate the immune flare. But what will the side effect of the immunosuppressants? They will make immune system susceptible to other pathogens. So next is AIDS or acquired immunodeficiency syndrome caused by HIV. It is a retroviral disease, and the genome is of RNA. So what will AIDS would do? Sorry, what would the HIV virus would do? HIV would go to the host cell, and it will bind with the CD4 cells by the GP
और
120
कितना देर होगा?
ligand. Sir, there are drug and alcohol abuse and cancer remaining.
अच्छा, 10 मिनट में हो जाएगा ना?
हाँ sir, I will try my best to conclude in
चलो
10
करो,
minutes.
करो कंटिन्यू.
Yes, sir. So, what would HIV do? That it will bind to the CD4 cells, GP120, and the co-receptor of the host cell is a CCR5 receptor or CXCR4 receptor. So, when it would bind to the CD4 receptor, what will happen? That the HIV would engulf by the cells or endocytosized by the cells, and HI would release certain pre-integration complexes, which would include the viral RT or viral reverse transcriptase, which would converts the RNA to the DNA. And what will that particular DNA would do? That particular DNA would recombine with host cell and produce new viral RNA. So that new viral RNA could produce the proteins or the uh, viral proteins, which will make new virus. And after consuming all of the host cell nutrients, the mature virion get exocytosized So the con of the HIV is it would bind to CD4 cells, and it would reduce the capacity or the efficiency of the immunity. They will directly attack to the immune cells. So what would be the conclusion of that? That if certain cells or certain viruses would adapt to immune cells, basically our defense mechanism would be decreased, or the strength of our defense mechanism would be decreased. So it will decrease the strength of our immune system. The diagnostic, how we are going to diagnose the HIV. So for that, we are using ELISA, or enzyme linked immunosorbent assay. So the next disease or next non-infectious disease is cancer. So cancer is typically uncontrolled cell division leading to the formation of mass of such cells known as tumor. So what is the key thing in cancer? The key thing in cancer is contact inhibition. So the contact inhibition is the property of normal cells by virtue of which contact with other cells inhibits their uncontrolled growth. So what will happen if a cell is growing, and besides a normal cell is growing, what they will do, they will not cross the path of each other, and in the situation of the cancer, they will uh, they will form a bunch. So when you see normal cell line, that would be of a monolayer. Okay. And when you see cancer cells, they would be in a clump or a bunch. So cancer cells lost the property of contact inhibition, and which will result of the cancerous cells to continue to divide and giving rise to masses of the cells called as tumors. So what are the two types of tumors? The very first is benign, and second one is malignant. So the benign tumor normally remain in confined to their original location, and it will not spread to the other parts of the body. So typically benign tumor are immobile, and the malignant tumors are mobile. Malignant tumors are mass of proliferating cells called as neoplastic or tumor cells. So malignant tumors would grow very rapidly, and which would invade ultimately and damage surrounding tissues. So the property by which the cancer cells move to the distant places from their origin by the blood and invade the normal cells and make them cancerous, which is called as metastasis. So what are the causes of cancer? Carcinogen, uh, so which would be of physical, chemical, and biological type. What is carcinogen? That particular variable would cause cancer. So it is known as carcinogen. So physical carcinogen includes ionizing radiation like X-ray, gamma rays, non-ionizing radiations like UV rays. A chemical carcinogen include tobacco, smoke, and some other chemicals. Biological carcinogen includes the cancer-causing viruses, which are also known as oncogenic viruses, which would have the genes known as viral oncogenes, by which they will cause cancer. And the cellular oncogenes or proto-oncogenes in normal cells, when they will get activated, would lead to the oncogenic transformation of normal cell line to the cancerous cell line or continuous cell lines. So how we are going to diagnose the cancer? So the detection of the cancer would be with the help of this following uh, treatment, this following methods: that biopsy and histopathological study of the tissues, radiography by using X-rays or CT scan or PET scan, which is positron emission tomography, MRI, the magnetic resonance imaging, the use of antibodies against the cancer specific antigens. Treatments of the cancer include surgery, radiation therapy, chemotherapy, and biological response modifiers such as alpha interferon, which would activate the immune system and help in destroying tumors. So, the last topic of this evening is drug and alcohol abuse. So, this certain chemicals in the surrounding or in the biosphere, which would cause the dampening of our thinking ability, or you can say that they will reduce the uh, central nervous system thinking capacity. That would be a layman term. So the drugs which are commonly abused are opioids, cannabinoids, and coca alkaloids. So opioids are the drugs which will bind to a specific receptor known as opioid receptor, present in the central nervous system and GI tract. So there is an example of heroin, commonly known as smack, is commonly diacetylmorphine, and which is white, odorless, bitter crystalline compound, and obtained by the acetylation of morphine, extracted from the latex of poppy plant, Papaver somniferum. So heroin is a depressant, and which would slow down the body function by slowing down the CNS. So the other type is cannabinoids. Cannabinoids would interact with the specific type of receptor known as cannabinoid receptor, and uh, uh, typically they will slow the CNS. Natural cannabinoids are obtained from the inflorescence of the plant Cannabis sativa, the flower tops, leaves, and the resin of cannabinoid plant or the cannabis plant used in the various combination of produce marijuana, hashish, charas, ganja. So what would be the effect of the cannabinoids? It will affect on the cardiovascular system of the body. The third part or third type of the drugs are coca alkaloid. So the coca alkaloid or cocaine obtained from the coca plant Erythroxylum coca. So the coca alkaloid interfere with the transport of the neurotransmitter dopamine. So because it will interfere with the dopamine, there would be certain dopamine deficiency like Parkinson and Huntington disease when the higher dose of the cocaine could be experienced or seen. So the cocaine, commonly known as coke or crack, so it has a potent stimulating action on CNS, which could produce a sense of euphoria and or known as increased energy. So excessive doses of cocaine, which would cause the hallucination. Some plants with the hallucinogenic properties are atropa belladonna, and drugs like barbiturates, amphetamines, and benzodiazepines, and lysergic acid diethylamides are used as medicines to help patients cooperate with the mental illnesses like depression, insomnia, and often which would be abused. So the morphine is a very effective sedative and painkiller. Uh, Another example of coca alkaloid is tobacco. Tobacco contains nicotine. Nicotine stimulates the adrenal gland to release adrenaline or and noradrenaline, or epinephrine and norepinephrine into the blood circulation, both which would raise the blood pressure and result in the bradycardia or increased heart rate. So, what will it do? Smoking of tobacco is associated with the increased incidence of the cancer of lung or lung cancer, urinary bladder, throat, oral cavity, bronchitis, emphysema, coronary heart disease, gastric ulcer, etc. So, how the adolescence and alcohol abuse would happen. So, adolescence means a period or a process during which a child becomes mature in the term of attitudes and his beliefs for effective participation in the society. So the 13, 14, 15. So this teen age or 13 to 90 years of the age may be of thought of as adolescence period. which is accompanied by several biological behavioral changes like curiosity, need for adventure, and excitement. Experimentation constitute common causes which motivate youngsters toward the drug and alcohol use. So addiction and dependence. So addiction is a psychological attachment to certain effects such as the euphoria, temporary feeling of well-being associated with the drug and alcohol. As already have discussed, that the euphoria is feeling of increased energy, and you would feel joy. With repeated use of these drugs, the tolerance level of the receptor present in our body increases, and consequently, the receptors respond only to higher doses of drugs or alcohol, leading to the greater intake of the addition. So, what our body would become, that our body would become resistant to that particular drug. So, we would take more of the drugs to satisfy our needs. So, dependence is the tendency of the body to manifest a characteristic, an unpleasant withdrawal syndrome, if regular dose of drugs or alcohol is abruptly discontinued. Withdrawal syndrome is characterized by the anxiety, shakiness, nausea, and sweating. So these are the effect, prevention, and control of the drug alcohol abuse. So immediate effects are reckless behavior, vandalism, violence. Excessive doses of drugs may lead to coma, death due to the respiratory failure, heart failure, or cerebral hemorrhage or hemorrhage. Uh, those who have taken the drugs intravenously can get infected with AIDS, hepatitis B. The chronic use of the drugs and the alcohol damages the CNS and causes liver cirrhosis. The use of drugs and alcohol during the pregnancy is also known to the adversely affect to the fetus. Use of anabolic steroids in females can cause masculinization or the male characteristics in female, increased aggressiveness, mood swing, depression, abnormal menstrual cycles, excessive hair growth on the face or the body, enlargement of the clitoris, deepening of the voice. In males, anabolic steroids can cause acne, increased aggressiveness, mood swings, depression, prediction of the size of the testicle, decreased sperm production, potential for the kidney liver dysfunction, breast enlargement, as well as premature baldness, enlargement of the prostate gland. So, how we are going to prevent and control the drug and alcohol abuse? The measures useful for the prevention and control of the alcohol and drug abuse among the adolescents are following: are to avoid under peer pressure on children. Children should be educated and counseled to bear the problem and stress in life. The child should seek help from the parents and elders. So the affected individuals should seek medical help of qualified psychologists as well as psychiatrists and the de-addiction and rehabilitation program. So this was my presentation. Thank you for hearing me and bearing my bad English. Thank you. Thank you so much.
Good, 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 good.